Good afternoon. This is Dipankar Sen. Welcome you to yet another episode of COVID Care by Heartcrafted Foundation. Today we have with a very famous orthopedic surgeon based out of Durgapur, West Bengal, Dr. Dipankar Sen. Before I talk of Dr. Sen, who happens also to be my childhood friend, let me talk a little bit about this series. Heartcrafted Foundation, which works among the underprivileged women in the northeastern part of the country, and provides them support to improve their livelihood and income, has been doing this series to cover ordinary people who have done extraordinary work during the lockdown and COVID. As you know, when COVID happened, we are all challenged. Privileged people like you and me were challenged with supplies. We were challenged with healthcare, near and dear ones. People who are poor, we have seen them walking on the streets. They had no income, they had no cash, they have no food. The government took some time to gear up and provide the support. But in the interim, hundreds and thousands of ordinary individuals came and supported these people in need. They provided food, they provided shelter, they gave healthcare, they raised money, they do whatever they can do within their limited resources. However, if you look at the people who suffered extraordinarily and people who supported, beyond that, there is a huge number of individuals whom we call essential services workers or frontline workers who had absolutely no choice. These are the peoples in the medical fraternity, people who are in the municipal corporation, people like police, and many others. In fact, the number probably is around 2 to 3 million in the country. And the foremost among the frontline workers are the doctors, who from the very first day jumped into how they can save more lives. If you remember, in the early days, we had very limited knowledge about the disease, about the virus. We did not have enough PPE, face masks. We did not have equipment. We did not have, obviously, even today, we don't have a vaccine, but that time there was no medicine. There was no protocol. And absolute chaos. People were scared. But doctors actually moved in quickly, probably they are the people who went closest to the affected people and literally put their life at grave risk so that people like you and me can survive. And we have very recently seen that there are scores of them actually have paid with their life. So we should remain indebted to them for the time to come for really taking us through this grave crisis. Let me come back to Dr. Dipankar Sen. Dipankar is a childhood friend of mine. We studied together and know each other for maybe 40 plus years. But nevertheless, it is on me to give a brief background of his. He is a resident orthopedic surgeon in the steel city of Durgapur. He did his schooling at Durgapur, followed by medical graduation from NRS Medical College of Kolkata. Subsequently did his master's in orthopedics in JIPMA and worked for about 18 months in the plastic surgery department in JIPMA itself. Dr. Sen completed the primary fellowship FRCSED from the Royal College of Surgeons of Edinburgh in 1999 and worked at various UK hospitals for academic and training purposes for almost 11 years. During this time, Dr. Sen continued with his academic pursuits. He took admission in the University of Liverpool in 2004 in the prestigious MCH orthopedic program, which he completed in 2006. Dr. Sen's scientific dissertation work on the failure of fixation devices in the hip fracture was accepted and archived in the Liverpool University in the United Kingdom. In 2009, he completed the exit fellowship of the Intercollegiate Board of UK and was awarded the degree of FRCS, Trauma and Orthopedics by the Royal College of Surgeons of Edinburgh. Now, as you all know, this is probably the most sought after degree for all the surgeons from across the world. Dr. Sen, however, decided probably at the peak of his career in UK to come back to his hometown in Durgapur in 2010 and then joined as a consultant orthopedic surgeon in the Mission Hospital, which is situated in city center Durgapur. I look at it as a unique journey of coming back to the roots after achieving global success and recognition. And apart from my friendship and apart from my even otherwise affection for him, I have a huge regard for Dr. Sen for really making a decision which probably most of us will be very scared to take. Dipankar, yes. I will take the liberty of calling you Dipankar here, not Dr. Sen or Dr. Dipankar Sen, okay? Now, Dipankar, when this COVID happened, As I mentioned, all of us were scared, worried about ourselves. But somebody like you, who is a doctor, who is, you know, even by profession, have to be close to the customer, close to the patient, and have to provide the treatment, no matter whatever is your risk, right? If you go back your oath and if you go back your professional value. So what was the initial reaction? I'm sure you were also, as a human being, were worried about yourself and your family. And you know that every day you go to the hospital, you possibly can be a potential carrier, which can be endangering your whole family also. So what was your thought process when it happened?
Right. So, Dipankar, again, I take the liberty to call you Dipankar. First of all, my sincere thanks for taking this initiative and introducing me to this your series program which you have been doing, and I believe thousands and thousands of people will be really benefited by looking at your series. Thanks very much for taking this initiative. Coming back to your question, what was your initial reaction? I will take it as I will describe it as a surprise attack on a country or somewhere where you do not expect suddenly things start falling from the sky. So you do not have much of a time. So after just withstanding the initial shock, you need to compose yourself, control yourself, and then go all out just to see what can be done to prevent any further damage. So that was the bottom line, I will say. So when this thing first struck, like we were hearing about this COVID from probably, I will say, December 2019 onwards. But as it didn't really came hard into the country, we were not very, what I'll say, not very concerned about that. But then from February, March onwards, as number of cases started trickling into the country, we are listening about the consequences or havoc which has been created in the European countries. Then it took us a few days to understand the severity of the disease. It's like something like a new bomb, maybe an atomic bomb or something which were dropped. So people initially didn't understand what it is, and then it was too late. So the response to the COVID was something like that. First of all, don't know what you are fighting. You don't know how you're going to fight. You don't know what course it is going to take, and you also don't know the outcome. So, with your limited resource and knowledge about similar epidemic of viral diseases, which we heard about, none of us probably have faced such a situation in our lifetime. So, those experiences were of say 50, 60 years of old. But even from that, whatever we could gather, with that, we knew that we had to come forward, fight, and then see what happens. In the meantime, obviously, there are specialist people who went deep into the disease. They tried to identify what is the cause, what is the mode of its attack, how it can be prevented. So anyway, these people are still working on it. And probably the outcome will be a vaccine or a treatment, successful treatment. But yes, at the early stage, after just withstanding the initial shock, probably I told to myself that yes, I am a soldier. So now the war has started. I can't refuse to be in the front line. It doesn't matter whether you are attacked or not. With your limited resources, you go do what is sensible and logical. That means, well, within a short time, whatever information in the initial days which were pouring into the internet, I went into that. I understood a little bit about it. I consulted a few of my friends who are into the epidemiology, virology. I asked them that what should I do? What should I do for the patient? What should I do for myself? What should I do for my family and the community as a whole? So with all these resources gathered, I came out and I decided that no, I can't stop treating people. So that was one thing from my day one. I never stopped seeing patients. Not for a single day, I can say. Everybody who had a back pain or this and that, yes, at the beginning we were saying, okay, my friend, if you do have a long-standing 20 years of knee pain or something, please hold for a few days. But yes, if you have a broken bone, if you have an acute injury, yes, I'm there. Please come. At that time, whatever precautions we knew that need to be taken, like wearing a mask, using a sanitizer or whatever as it evolved, take those precautions and do your job. That was my bottom line, probably from the very beginning of the episode.
So Dipankar, you obviously are, there are so many people, thousands, if I'm not mistaken, who have been your, who have been treated by you, even in your mission hospital tenure. I'm not talking of the time before. Now, and you are a very amiable, approachable doctor, and you also have this Prayas Foundation through which you are trying to help some underprivileged people at various points of time. So I'm sure there are a lot of people who not just looked at you during this time just to get treated for whatever orthopedic problems, but I'm sure you got a lot of, people in panic calling you up saying, what to do and stuff. So there was a element of, reassuring and educating also was there in your job, right? Which you, I'm sure you did. So tell something about that. How
Yeah,
did you
I mean,
manage?
at some point, I had to probably work as a general physician, because when somebody calls me that doctor, I'm not finding anybody. I just got your number somehow. I said, okay, fair enough. What's the problem? Then I can see maybe his son or daughter is having a simple fever or a stomach upset or something. I said, fair enough. Although I'm an orthopedic surgeon, but at the end of the day, I'm also an MBBS doctor. So I can do a first line. I cannot really go too much. But yes, for a fever, you can prescribe a paracetamol. If somebody is having a breathing problem, you can give a little bit of nebulizer. If somebody is having a spasmodic stomach upset or something, you can give something to cool down the stomach, and etc., a dose of antacid, something like that, which I have done. I've never refused to see any single patient, be it orthopedic or non-orthopedic. And yes, that's all I could do at the beginning of the episode.
So, you know, now that, you are obviously one of the senior person in the hospital, right? Though you may not be on the administration side, but your team, looks after to you. In fact, everybody looks after to you. And this is a crisis where, there is obviously a call of duty, but at the end of the day, everybody is very human also, right? And I'm sure within the hospital, apart from the patients, there is this huge fear or uncertainty among the staff members, not just the medical, paramedical, there are so many other, and everybody was looking for reassurance, everybody was looking for safety. Now, how did you, if you give us a picture, how did you maintain? And, whatever we have read or heard so far, but for some cases where doctors have, or nurses have protested for not getting salary, we have never seen any case in India where, people have put their, the, if we may say, scalpel down to say that, I will not look at the patients anywhere. So there's an extraordinary thing that has happened in the hospital in terms of leadership. So give a sense of how you created this confidence among the other people.
Leading from the front, you become an example. Everybody all over the world, they will look for an example in similar situations. If somebody leads what I say, that suppose there's a rough road ahead and there are bumps, there are ditches and everything. And then you have a people behind you to follow, they're scared to tread the path. But then you can say that, okay, look, follow my steps. I'm covering, or I'm jumping over this ditch like this, or I'm dodging this one like this. So you lead by an example. So that's exactly what we did. I started, or actually, I never stopped working. I continued to do the work. I used whatever precautions, necessary precautions to be taken, and I continued with a standard scientific way. And then when people ask me that how are you doing, I said, you can just watch me how I'm doing. So there is no reason to panic. Actually, this epidemic episode, it became more of a psychological sort of havoc rather than any medical. Yes, I do agree that there was a medical problem, but because it was never heard of, there was a lot of mental or psychological component attached with this. So I addressed that. I said, okay, there is nothing to worry about. At the end of the day, even if you get the disease, it's like a flu. This should be treated by standard scientific means, and life has to carry on. I heard at least 1,000 times that people in the OPD, they are saying that, okay, doctor, if you are doing this, you are safe, then we can be safe also. I said, yes, why not? You just follow the same precautions. Like I am washing my hands repeatedly. I'm maintaining a reasonable distance between the patient and myself. And of course, with my practice, it is not always possible to keep that so-called 2 meters or 3 meters, whatever is recommended. But as I come close, I have to wear a face mask. I make sure the person is also having a face mask. There are temperature screening applied just before they enter through the door of the hospital. So these are the precautions which were taken. And then with that, you just tell people that, look, I am living this way. You can also live this way. So that's what the fact, that's what the fact. And then given that I am working in this area for about 10 years now, many people know me. Uh, some of them obviously came to me for various types of ailments, and when they see, they say, okay, doctor, so if you are doing this, then it's reasonably good, isn't it? I said, yes, it is good. So you follow it in your practice. And this guy goes back home and educates his surroundings that, okay, doctor has said, okay, this is the way it should be done and we are safe. So that's the way probably my thought process was percolating into the society. Other than this, as you can say that how did you generate this type of awareness? I took the help of the social media. Actually, I was not a very great person in the social media, but as this episode came, we lost contact. And then I understood that at this time, probably the social media is the only pathway by which I can remain connected with people outside. So I myself created and published many videos. Actually, I created a YouTube channel for myself, which I never did for the last 10 years, in spite of many people telling me. But yes, I understood this is the time it should be done. And then I produced videos, how to wash hands, how to take care of your child, how to take care of your elderly father, how to adapt to your office, how to take care of mental stress. All videos, short videos about 4 minutes, 5 minutes. Then I created the YouTube channel, published it, and whenever patients came, I just say that, okay, go through this. When they ask for a particular problem that my child is not going to school, he's upset, I said, okay, whatever I could understand, I had said something, have a look. So I used the social media in this last 5-6 months, really much more than what I have used in my previous days, to generate ways or to show people the way life should carry on. You can watch in my YouTube channel. There are some 8 or 10 videos in the Corona times.
Yeah, actually, I incidentally have seen a couple of them, especially the hand wash. I saw that, and I was really thinking of you asking that time that Dipankar, you are saying this, but are you able to do it in your job? Because for somebody like me or many others, it's you can really stay away and wash your hands a couple of times a day. But for you, you have to do it every moment. As you rightly said, you have to go on washing your hands, go on maintaining distance, wearing this, PP
Actually,
suits. So
that has
life
become
is,
a habit now. That has become a habit now. it just probably reflects that I I wash my hands after every single patient now.
Right, right. No, so I saw that. I saw the demo of your hand washing, and I was just, it just occurred just because you're a friend that, it's such a strict guideline, how long we'll be able to do it. But then probably most people have adopted it. Now, Dipankar, this is very interesting, and I really happy to hear this, that, I have been to one, uh, early days, Junali, my wife, she had some issue, and we had to go to our local hospital, and we were told that many of the people who are not in the medical or in the front line in the private hospital, have taken a break and gone home. I think not everybody was actually working because it was not mandatory for the private sector. So great to hear that even when you are in a super specialized area like orthopedics, you could have easily said that, I will come to hospital only when there is a patient. You ensure that you are there every day, which is not just helpful to the patient, but uh, you have to uh, you have to deal with additional participant. Now that
Yeah.
is also a great moral booster for other employees, right? Other people in the hospital who are actually in many ways comparatively less privileged, right? The people who are support
I
staff
mean,
and
that's
all
what
that.
I said, that you lead by an example. People love
They
to
don't have an
see that
option.
somebody is doing.
Yeah. So now that we are I probably coming very close to the end now. We are probably, many are saying that we are beyond the peak because numbers have reached 98,000. Now it has become 70,000, 60,000 per day. But there is always this fear that, something like this can happen again. Obviously, that is always there. And apart from the social good, which has happened, exposed in one side, it has exposed a lot of people who are poor. It exposed a lot of people, goodness in people. It has helped us to, slow down. Most of us, probably are having a better life, we're eating at home, less stressed. Now, if you have to take some takeaways as a medical professional from this, which we should, continue to hold good. Do you have any thoughts? I would like to give any message as a doctor.
Yeah, I mean, my message will be that let's do something scientific. There is no point in just working or reacting to comments and this and that from every single source. Uh, Keep your cool, be logical, follow scientific advices from doctors or physicians, whoever around you, and don't be harsh to the people who are suffering. They are just like having a disease. Like if your neighbor or somebody is having the disease, there is no point in ostracizing them. They will die, and tomorrow it may be your turn. So do something scientifically to help these people so that they can recover. And the help in these difficult times will be remembered. So that neighbor will be for your friend for your life. So you should never do that just because somebody is suffering, lock his flat. Like we have heard stories, people are not listening. These are really heartbreaking. Don't do this. Um, Follow the specific hygiene or advices which many people have promoted. Keep distance. People are talking about social distance. This is something I could never understand. Probably I understood more the physical distance. Okay, 2 to 3 feet or 4 feet, whatever. Do not indulge in unnecessary mixing up, be it a social gathering, be it a religious gathering. That means exposing to risk. Keep yourself less exposed to risk. Uh, that's all I can say. That's all probably will do the job.
Yeah, very well said. I think, and I guess, you will obviously be much better to comment, but I think that this whole ostracization and stigmatization reduced over a period of time, obviously because so many more people got affected. And it was really sad, it is not just people ostracizing and, sort of as if they have done something wrong, it literally going behind them to find out where did they go. And also, the being a animal lover, I have heard or seen so many cases of people leaving their dogs and cats just because they are scared, that is a sad part, but I'm sure we'll all learn uh, as part of this overall learning that, we need to really stay united when things really go south, because it can be tomorrow myself and there may not be enough people to support me. So Dipankar, thank you so much. I am done with my set of questions. Do you want to leave anything else for the audience?
Uh, well, I mean, through your channel or whatever, I again like to ask people uh, just to stay calm, uh, follow the scientific advices, take care of few people around. At the end of the day, yeah, if these people fall, then ultimately, finally, it is your turn. So better you take care of your surroundings and they take care of you. With that, I think I say thank you very much, and it's my pleasure to have this interview with you.
Thank you, Dipankar. Thanks for taking time off a very busy schedule. I'm sure you have to go back now again to,
So
to,
enjoy the
to
puja holidays
oh
at
yeah,
home as best
enjoy
as
the
possible.
pujas.
And yeah, I'll have my outpatient clinic starting at around 3 o'clock. So I'll be heading there soon with after a cup of tea.
Chalo. Take care. Stay safe. Take
Okay,
care.
bye.
Bye bye. See you soon.